Created 3 vignettes to help us start thinking of culture as more than just the neighborhood that we live in or the people that we surround ourselves with. I've created these to help us start thinking of culture as the extended definition of age, gender identification, spirituality and faith-based, socioeconomical ability status. So the 3 vignettes are: number 1, while working with a client and her young daughter, you notice red lesions all over the child's arms and legs. This is a 7-year-old, and the reason for counseling is to help the family transition after the death of the grandma who lived in the house with them. You have no reason to suspect abuse before this moment, but are concerned with the cause of the marks. You take note of this and intend to ask before the end of the session, but before you can ask about the marks on the child, she leans forward, exposing a portion of her back, and the red circular marks are also on her back. You find a break in the conversation and ask the child how she got all of the marks on her legs and arm and back. She responds that the marks are a result of cupping. She starts to tell you that she had the procedure done yesterday, but then stops and asks her mom for help in remembering the day. Her mom casually agrees that she did indeed have the procedure that caused the marks on her body done the day before the session with you. In an effort to determine the reason for the procedure, you begin to ask questions of the child. You've been working with this family for a month or so and have developed a trusting relationship. You ask her if it hurts to have the procedure done, and she says no. You ask her if she wanted to have the procedure done, and she answered, I don't know. The young girl tells you that it helps her, but is not able to articulate how it helps. It's clear to you that the answer that the young girl has given you is an answer that she has heard and not an answer that she understands. The mother interjects that the child has been having the procedure done since she was about 4 years old, and that she has it done about every few months or so. The mother states that the procedure increases circulation, promotes healthy blood flow, and helps to rid the body of any ailments. Mom goes on to explain that the child had the procedure done the day before because she had been sick over the last week. The mom tells you that her daughter has not been feeling well in the last week and that this is how they would be treating that illness. You ask the question to both the mother and the child where they had the procedure done, only to learn that they had gone to a holistic doctor in the area. Information on cupping. Cupping is a process that you have heard of, so theoretically, cupping is a process that you have heard of before, but have not seen the result of in person. Despite there being several locations locally to meet the growing demand of this entirely holistic approach to medical treatment, this is not a procedure that is done in a medical setting that subscribes to Western medicine. This is not a procedure that is covered by medical insurance and has come under scrutiny since its emergence in the Western world some number of years ago. This procedure is not illegal in most instances, but the procedure of cupping has been a highly talked about and debated procedure in both the news and in cultural seminars that you have attended. The result of the procedure has been heavily debated, especially as it pertains to children. As a mandated reporter, you are weighing out whether you feel this instance counts as abuse or not. This family is of a different culture than your own, and they do subscribe to many Eastern medical practices. This is not the only instance of medical treatment that reflects their diverse cultural beliefs and practices. However, this is the only instance in which the process has a visible outcome. The child does not seem to be bothered by the marks on her body today, but you did not see her reaction to the process the day before. This practice gives you reason for concern, but you know that in their culture, that this is a normal and acceptable practice for children of her age. As the counselor, it's your responsibility To show no emotion or bias towards this practice. It's your responsibility to continue to create an uninterrupted, supported, and very client-centered atmosphere. No matter how you may feel about the family's choice to participate in something that may be abnormal to you, it is your job to remain non-reactive to the situation. As the counselor, your services were sought on behalf of the child, and you should be the child's advocate, even if you are bound by the parent's instructions. As a minor, the parent is in charge and does get to be the one to make the decisions regarding the child's treatment. Legally and ethically, you are bound to the parent, not to the child, as the child is a minor, except in instances of abuse or suspected abuse. If as a counselor you were to feel that there was abuse on the part of the parent or that the child was being abused, whether the parent knew or not, it would be your responsibility to report this action even if the parent did not want for you to report it. At any rate, it would be wise to consult with your supervisor over the matter of the cupping. You most likely have someone who oversees the work that you are doing, a licensed professional, a mentor who has agreed to work with you in cases just like this one, an identified supervisor, or perhaps just the church pastor at a minimum. Following the proper ethical protocol, it would be good to have a confidential conversation about your experience with this family. Research local and state standards regarding this practice, and even if the facility where the family had the procedure done and what sort of services they offer, if there has ever been any trouble with any of the procedures that they have offered. Because of the nature of the procedure and the visible effects of the procedure on the child's body, you should not let this instance go without doing due diligence. Once you consult with your supervisor in an ethically sound manner, the conversation should be one in which you are not breaching any ethical or legal standards as far as confidentiality. They may be able to help you decide how to proceed in the counseling process with this family, or your supervisor may be able to help work with you to arrive to your own decision on how to proceed. Example number 2. As a pastoral counselor, you start working with a new client. She brings in a home-baked item on your first visit. This is an individual that you have attended church with for the last decade. You have served next to her at church functions, participated in committee activities with her and her family members, and have had many conversations with this individual that were not in the counseling setting. But today, she has scheduled an appointment with you as the church counselor. As a member of the church, there will be no charge for the session as the church compensates you, the counselor, for your time. She was made aware of the fact that there would be no need for payment for the session together. And you are aware of her culture and her family values. You know that there is no event, activity, or gathering, or time spent together that goes by without some home-cooked food of some kind. While it is not normal practice for people to bring food or gifts to a counseling session, you express gratitude and begin the session. You give this very little thought and finish the first session. At the beginning of the second session, she arrives with another home-baked delight. You carefully and casually tell her that she does not need to make or bring you food, but thank her still. Second session closes just as the first. The third session comes with another baked good. You show gratitude and tell her that she does not need to bring anything. You carefully consider if this particular client feels obligated to bring something as a form of payment. Even though no payment is required, you wonder if she feels that she owes you something. You don't want for the relationship to become one of obligation, but you also want to avoid insulting this individual by asking her not to bring anything. You're able to see that the client is making the baked goods and bringing them to you as a sign of gratitude and not of obligation. Because the reason for giving you something stems from a place of gratitude and not one of obligation, you decide not to say anything about the manner. For now, in the pastoral setting, you feel this is an acceptable gesture and continue with the remaining 2 sessions.